Hi everyone, welcome to the Aesthetic Treatment Room. So my name's Rachel, this is Dr. Helen.
Hello.
Today we are going to be discussing fine lines and wrinkles. So this is our third informative video on problems that people have when they come into the aesthetic clinic. I think we'll probably both agree that fine lines and wrinkles are the most common thing that people want solved really. So it is something that is going to happen to everybody. Unfortunately, it's part of the natural aging process. A lot of people say that it makes them look older than they really are, so they're wanting to sort of get things looked at from that point of view. Don't worry though, there are things that can help you, but in order to find out what's going to help you, we need to work out what it is that's going to cause it. So Dr. Helen, what causes fine lines and wrinkles?
I think there's a number of factors that we'll have to consider here, a number of things that come into consideration. It ultimately comes down to a breakdown in structure in the skin. And as we've spoken on our previous videos, the skin is made up of collagen for its strength and elastin for its elasticity. And when these two substances get broken down and they're not repaired in the same way, then we get this problem of lines developing and structures kind of breaking down a little bit. So it means that our skin can't quite bounce back in the way that it perhaps once used to. So the first thing we'll look at is the location of where the lines and wrinkles are, because we tend to find that where there is a lot of movement on the face, that's where people normally come and want treated, that we tend to end up with more lines and wrinkles where the skin is getting constantly folded and moved around. So common areas are crow's feet, sort of around the eyes, frown lines, especially if you spend a lot of time like squinting into the sunlight or frowning. Again, sort of up here when people are raising their eyebrows a lot and we have a lot of expression, we can end up with a lot of lines and wrinkles there. Or another area is round the mouth. So it's commonly called smoker's lines, but it can just be caused by, again, repeated movement in that area. So it's not just movement and unfortunately the natural aging process that comes into play. We also have to consider environmental factors such as UV light. We know that sunlight is a huge factor for sort of progressing the aging of the skin. And a lot of damage can be prevented by wearing SPF, which is something that we talk a lot to our patients about, isn't it?
We nag them.
We do. We nag them about
Similar
it.
to talking about.
Because the sunlight itself can damage the collagen and elastin, it leads to premature aging. So that aging process is speeded up. Again, the same with smoking. Smoking can accelerate the aging process. It stops the blood flow to the skin, so it just stops the skin turnover as much. As I say, as well as pollution, stress, poor diet, poor nutrition, anything that is going to stop the skin repairing as well as it should be, and these building blocks for the collagen and elastin, that's also going to help with it. Help with the formation of these lines and wrinkles, and of course genetics. So unfortunately you can't fight what the genes have been given to you sometimes. So sometimes you might need a little bit of help. So there are things that you can do on your own to minimize the lines and wrinkles. We can start to look with, like we've said, with the SPF to try and protect your skin against environmental factors like UV, but these little things that you can do at home with your good skincare and your good diet sometimes aren't quite enough, and that's where we come in. So we can offer a few different solutions to help to address lines and wrinkles, and that can be things like areas where you've got excessive movement. Perhaps a bit Botox, botulinum toxin might be appropriate. If we stop the muscles moving, then we can stop the lines from forming. So it can be preventative as well as a treatment. Obviously, if lines are already ingrained into the skin, stopping the movement will not necessarily cure those lines. So if the lines are there when you're resting, it may help to soften those lines, but it's not necessarily going to get rid of those lines. So it's something that we kind of have to take into consideration with that as well. But that can be used to really address anywhere on the face where we've got a little bit of movement. But there are other treatments, aren't there?
Yeah, there are other treatments that are available, or even to go alongside that. So as Helen said, if the lines are too deep, you might be looking at wanting to have a bit of skin resurfacing. So in these cases, what you're looking to do is removing the top layer of dull dead skin, which can make the lines look less deep. This would be things like chemical peels, microdermabrasion, laser resurfacing. They would all help just remove that top layer of skin and generally exfoliate the skin to make those less deep. And then, I mean, with chemical peels, there's different strengths that you can use.
I mean, we've got our hero product here, haven't we? Our Bio
Repeal is basically our go-to, isn't it? We pretty much use that for anything, because the thing with peels is you need to look at patient's lifestyle, like what sun exposure, or you need to look at the shade of the skin, and there's a lot of different factors that you need to look at, lifestyle choices, whereas BioRepeal, the one that we always use, it's basically safe to use on the majority of people, which is why we use that. But there are other peels that you can use, different strengths. Obviously, the stronger the acid, the deeper it's going to penetrate. So if you're looking at like a really deep line, you're probably going to be looking at having quite a deep peel. There are also injectable treatments like dermal fillers. So if you've got quite a deep line, you can look at sort of filling that in. So just a little injection where you're going to pop like hyaluronic acid, and that's going to smooth out that area. As Helen mentioned before, the folds as well. If you're going to get folds, it's quite common around here, you can fill that in around there as well. So there are quite a few different treatment options. The skin boosters, which again, injectable, something that's just going to help improve the skin's tone and texture, really.
Just helps with skin turnover, doesn't it?
Yeah.
I think actually another point when I was saying about the smokers lines earlier, dermal fillers are quite good for that, aren't they? For resisting movement around the mouth.
Yeah, for filling in the lines so that you've got a little bit more scaffolding, basically, just a bit more stability. So
I think it's important to remember though, even when we're talking about these treatments, that none of these results are permanent. So although we treat the lines, we treat the movement, obviously for botulinum toxin it wears off, so in 12 weeks you're probably going to be similar to how you were beforehand. Dermal fillers get broken down by your body. With chemical peels and sort of skin resurfacing, obviously your skin is continuing to turn over. Unfortunately, we all still continue to get older. So it is something that, you know, we need to kind of consider maybe a long-term plan and what we're going to do for maintenance, as well as sort of those initial treatments as well.
Yeah. Well, I think when you look at things as well, you're looking at, it's a lot more noticeable in females because obviously their skin's a bit thinner, so lines form a lot quicker. But obviously they've got socially they're expected to look a lot nicer, so they're expected to put a bit more effort in than men. Men can just wash their hair and away they go. But you're looking at things like hormonal changes as well. The reduction of estrogen can help,
help you to age.
It can lower how much collagen you're going to produce. So again, that's something that's going to...
Something to look forward to with menopause, isn't it?
Yeah, definitely.
Lovely.
Definitely. There's always something to look forward to.
I do think, I mean, whilst lines and wrinkles generally are more problematic for women, and I'm saying generally because it's not the same case for everyone, regardless of age or gender, everyone ages differently, and there's no one size fits all for anybody. So it's always a case of coming in, speaking to someone, seeing actually what's available for you, what's appropriate for your skin type, your budget, your long-term goals, and kind of going over with that. And I really think it's talk to a professional about it.
Yeah.
Someone like us.
Yay.
That's what we're here for. So we have actually got some appointment slots open in our diary for treatment planning sessions. And this is something that we've just done for this series of lives. So we've opened them up. They are limited. They aren't going to be there forever. If you would like to come and talk to Rachel or I about your problems that you can see, or you'd like some advice on anything, please go online, go to our booking portal, book with either Rachel or myself to the drop down list, and then we can look forward to seeing you, have a chat through the issues and see kind of what would be most appropriate for you. Look out for our live next week.
So next week we're going to be talking about loss of facial volume and deep facial folds.
So something else that
Something to look forward to.
Yeah, we get a few people asking about, don't we?
Yeah, definitely.
So we've hoped you found that useful today, and hopefully we look forward to welcoming you into clinic soon. Take care.
Bye.
Bye.